Erie County Executive Mark Polenkars with another COVID-19 update for you, live from the Rath Building in downtown Buffalo as we discuss the issues that we're dealing with here in Erie County and Western New York. Today we're joined by Sarah Thalen from Deaf Access Services, and I appreciate her work as she provides the American Sign Language for those that may have a hearing impairment. You have me solely today. Dr. Burstein is off, even though she's doing work, because I know she's been on a few phone conferences that I've already been on. The work is always here, even if you're not in the building. It is very busy with regards to the COVID-19 response. And I want to thank each and every one of the first responders, our healthcare workers, as well as those in county and other government that are responding to the COVID-19 outbreak. A lot of people have been home, I know, and they really wish they were at work. There's a lot of other folks who've been working nonstop since this started when I declared the state of emergency on March 15th. So I just want to give a big shout out to those individuals who've been working very hard for nearly 2 months now. As always, we have our little provisos before we start, just to let everybody know that the information that is being presented was valid as of the time it was provided to us and put into the presentation. It may have changed, and for the latest information, we ask that you go to our website, erie.gov/COVID-19, or you can always go to our interactive map at erie.gov/COVID-map, which has the latest updated throughout the day. As of 12 p.m. today, as of noon, there were 4,579 total positive cases of COVID-19 in Erie County. That is out of 27,864 tests. We previously said tested. It's actually tests. Those are the total number of tests. There may have been an individual who had multiple tests, so it's not 25,864 individuals. It's tests that were completed. When it comes to deaths, unfortunately, we have increased to 400 now. These are all lab confirmed cases. They were confirmed COVID-19 before they deceased. There are no presumed positive cases. This is an increase from yesterday's total, and I do offer my deepest condolences and sympathies to those who've lost loved ones as a result of this terrible outbreak of the coronavirus and the resultant illness, COVID-19. I know people who have lost family members, parents, grandparents, one sibling that was lost of somebody I know, and they just just can't understand how something so quickly could take their loved one, regardless of their age. Now, with regards to hospitalizations, we have much more hospital numbers. I'm very pleased that we were able to receive these, but we're headed in the wrong direction, folks. Lieutenant Governor Kathy Hochul yesterday noted we're not going to be opening on May 15th because we can't meet the standards with regards to hospitalizations. And as you'll see in just a moment, we are headed in the wrong direction from where we were. On May 11th, there were 203 individuals that were admitted to an Erie County hospital for COVID-19. This is an increase of since May 8th's low of 188. There were 72 in the ICU units on that date of May 11th, and 49 of them had an airway assist. And you'll see from the chart, this is a chart going back to really day one when we started tracking this. You can see we are missing 1 day. We've been able to acquire the data for many days that were lost. And you can see we were on a nice decline there, and it appeared we were continuing on a nice decline. But in fact, for the last 3 days, we've actually seen increases in hospitalizations at area hospitals. Deaths have sort of moderated at hospitals. That is the small bar on the bottom, the purple bar. I'm going to go to the 2-week data where it actually has the numbers, and you can see exactly what we're talking about. We had a high not too long ago in early May of 200, and we look at that screen there, it's easier for me to see, 245. And we were going down, and we dropped down to 188 on May 8th. But unfortunately, since then, we've seen a little decline each day. Now, ICU numbers have gone down. ICU intubations have gone down. But there are more new people entering the hospital. And that is very concerning because, remember, the two metrics that we have not met with regards to the reopening of the pause orders relate to hospitalizations and deaths in hospitals. On the bottom, you'll see that our deaths for hospitals have also thankfully gone down a little. On the 3-day rolling decline, we are showing less than 5 deaths in Erie County, but there may be deaths in other counties. There are, as I said, 203 people in hospital as of the 11th in Erie County. Those 203 people are evidenced by age range on the graph that you see before you, of which 21 were between the ages of 20 and 44. So there are younger individuals who are in Erie County hospitals. 75 were 45 to 64. Based on our analysis, we believe that almost all of these folks in the age ranges of 20 to 64 live at home or live in an apartment. They do not live in a nursing home. And you can see that we certainly have the majority of individuals in the age range of 65 and above, but we do want to continue to let people know that just because you're younger doesn't mean that you are immune from this. You could get the COVID-19, as we'll show in a second with regards to the percentages by age range. And you could be hospitalized even if you're younger, between the ages of 20 and 44. Now here's the hospitalization data for all of Western New York. And you can see that this data would be 3-day increase. Remember, we had a 3-day increase for Erie County. We're seeing a 3-day increase, of course, for hospitalizations across Western New York. Now, Western New York, as it pertains for reopening, is Erie County, Niagara County, Allegheny County, Chautauqua County, and Cattaraugus County. There are 214 individuals who were hospitalized for COVID-19 in hospitals in the Western New York region. And as I noted, 203 of them are in Erie County. So it's very important that we do what we can in Erie County to reduce that hospitalization number. I'm glad to see ICU numbers going down. I'm glad to seeing deaths stabilize a little bit, but as long as those hospitalization numbers are going up, New York is not going to allow us to open. I've had those conversations. I know they're very worried about it. So we got to keep that graph going downwards. We cannot have it going upwards. Hospital data with regards to admissions versus discharges. On May 11th, there were 11 new admissions and 22 discharges, but on the 2 preceding days, admissions exceeded discharges. It's been bouncing back and forth. If we continue to see discharges exceeding admissions, we'll be in a much better position. But if there are days in which admissions exceed discharges, it's going to be tough for us to get out of the situation we're in. So we need to reduce the number of individuals who are contracting the coronavirus, who then unfortunately get sick enough that they're hospitalized. So we need to do all that we can to flatten the curve. We have flattened the curve, but we haven't. When you see that curve starting to go back up again, that's a little dismaying. It's a little distressing, and we need to do our best to ensure that we continue to reduce the number of coronavirus contractions and COVID-19 cases in our region. By age group, these are cases, not deaths. And you can see it's not that different among the age groups. We have not tested a lot of young adults under the age of 19. But if you see, there's over 600 individuals who've contracted the coronavirus between the ages of 20 and 29. A little bit more than that between the ages of 30 to 39. And then, of course, the largest group is those over the age of 80, but those between the ages of 50 and 59 are just barely trailing that. So I think it's very important for the public to understand that any age group can contract the coronavirus. Every age group has contracted it, except, actually, I think below 1 there was a case. It's just not registering there because it's so small. But every age group has actually contracted the coronavirus, and you can get ill from it, and there are people who are young who are hospitalized. Tests, we continue to ramp up the testing. We'll talk more about that because we even got more good news to talk about testing. But as we've ramped up testing, the percentage of individuals who are positive for COVID-19 has decreased. So this is weekly data. This is effective as of the week that ended May 9th, and you'll see that we've dropped to 12.1% of all people who've tested during that week for the coronavirus at that moment. This is not the antibody test. This is the diagnostic test, tested positive. And that is the lowest it's been for quite some time, since at least the first week of April, in which nearly 29% of all people we were testing positive, though we were testing a much less group of individuals in our community. When it comes to antibody testing, once again, this is weekly data. We are seeing that through the first 3 weeks of data, that 7.8% of individuals who've tested for antibodies have tested positive. I think we all know that means. That means 92% of residents in Erie County, on an average, have not contracted the coronavirus. That means we are all susceptible if we were tested for antibodies and we came up negative. And when I say we, I'm adding myself, because I did get tested with an antibody test and it came back negative. There was a part of me that was kind of hoping it was positive, just like a lot of other people were hoping it would be positive, so that I would have built up some immunities, possibly antibodies. But I had a test done, and unfortunately for me, I guess you could look at it both ways, fortunately and unfortunately, I came back negative, which means I have not been exposed to it, and I am theoretically at risk for exposure and contraction myself again in the future. So that's why we wear our masks, and we also do that to protect ourselves, but to protect other people. Mortality data through this morning, there were 400 individuals, I said, who deceased. Once again, the ages, generally, it is affecting our senior population, our elder population, much greater than others with regards to deaths. 76% of all deaths have occurred in the age ranges of 70 and above. We have had some deaths in the 30 to 39 age range, as well as 40 to 49. But as we've said all along, this is an illness that really affects our senior population with regards to hospitalizations and deaths. And many of the individuals who contract it are, while they may be old, otherwise healthy. And so we're very worried about further contraction for those in our community, not just those in nursing homes, because we worry about those as well, so that we do what's best for our greater community, which is to stay home and help stop the spread as we try to get to a point where we can re-enter through phase 1 of the New York pause orders and New York Forward. Mortality data, this is the data based on age and gender, so you can see that, as has been pretty standard recently, every age range except for 80 and above, males make up the majority of those who've died. In the 80 and above, it's females, and we believe that's also because there are generally more females that live longer and therefore are more at risk when they're in their late 80s and 90s. The mortality data broken down by race and ethnicity. This has stayed pretty static recently. We haven't seen many changes. The percentage of blacks or African Americans has pretty much stabilized at 18.5%. For a while there, it was nearly a third, which is way out of whack from where it should be when the African American population of Erie County is a little less than 15%. But it is, as you see, more males have unfortunately, I shouldn't say unfortunately, more males have perished compared to females. In general, it treats it the same. It's roughly half, just barely over 50% for males, barely under 50% for females, though females do make up a greater proportion of Erie County's population. And the Latino, Hispanic designation of ethnicity is still much smaller than what the actual population of Latinos is in Erie County. They make up more than 5% of Erie County's population, and they're making up 1.5% of the deaths. Now, response, we've been talking about this since day one. We've been responding, not just waiting for some things to happen. And the biggest thing we've been able to do lately is increase testing. Erie County, of course, has opened up testing to anyone who believes they may be at risk of exposure or potentially was exposed. So you don't actually have to show symptoms. You can be asymptomatic. If you believe that you fall into that category, you can get tested. Call 858-2929. Once again, that's in the area code 716-858-2929. You do not need to have a doctor's referral. You do not need to even have a physician, but it is by appointment only at drive-in sites. So please call that number, and if you need foreign language interpretation, it is available as well. You've seen this talked about it for a while. Kaleida Health opened up a facility at the Leroy R. Coles Jr. Library on East Delavan near Bailey. I was there last week, and it worked very well. These are by appointment only, so you just don't come in and wait a long time. You actually have a designated time. You get in, you get out. You don't have to wait very long. It is from 9 a.m. to 5 p.m. on Monday, Wednesday, Friday for COVID-19 symptoms, people who have those. It is by appointment only. A lab order from your primary care physician is preferred, and you can register that and sign up for an appointment for a swabbing, so to speak, at the website that you see on the screen. Kaleida Health has other COVID-19 test locations, and including Worley Drive in Williamsville, Best Street in Buffalo, Union Road in Cheektowaga, the East Sullivan site. And you can call to schedule an appointment at any of those sites, 859-3222, between 7 a.m. and 7 p.m. And this is available for those that are ill or showing symptoms or may have been exposed. You can also do it online at the link that you see there. The New York State Department of Health has a testing site in downtown Buffalo in the Cobblestone District for people who have had close contact with a positive case, as well as, for example, if you're a spouse of someone who had it, you're a child of someone who had it and you live with them or you were in contact with them, you're a healthcare worker, nursing home employee, first responder, essential employees who interact with the public, truck driver. So any of those individuals can be tested by New York State. You call the COVID-19 hotline at 888-364-3065, and it is by appointment only, but you can drive right in, drive right out, and be tested at the Cobblestone District on Perry Street in the big lot that a lot of people park for when they go to Sabres games. Something new we wanted to talk about, we have a concern. I want to thank Dr. Myron Glick of Jericho Road Community Health Center for bringing to our attention that a number of the individuals that he's been testing from the Burmese and Karen community appear to be testing positive at a much higher rate than what we're seeing in the general public. So Jericho Road has a number of testing sites, including one tomorrow at its Broadway location and another on Friday for the Buffalo Myanmar Indigenous Christian Fellowship location for those that are Burmese and Karen. You do not have to be a Jericho Road patient. You do not have to or have insurance, have a lab order, or make an appointment. You do have, it's first come, first serve, though if you want to make an appointment, you can. You call 881-6191. Tests are administered at the provider's discretion, so Jericho Road will actually talk to the individuals. They will determine and feel if there is a risk. If you do have insurance, please bring it and bring a photo ID if you have it. And if you have a mask, of course, wear your mask when you're entering, especially if you're showing symptoms. But Jericho Road has a number of, upcoming testing locations on the 14th, 15th, 19th, 20th, and 21st. So we want individuals on the west side who may be at risk to utilize that. And if you are in the Burmese, the Karen community, we are worried about what appears to be a higher percentage of positive tests coming from that community. It is a very tight, close-knit community, and we've been monitoring this, working with the Jericho Road as well as individuals in the community to address this. I wouldn't necessarily call it an outbreak in the entire community, but we are concerned because we are seeing increasing numbers, and we know it's a very tight-knit community, and therefore we are taking no chances. And as I said, I want to thank Dr. Myron Glick of Jericho Road for bringing this to our attention and then having our health department work with him on a number of matters to address this. Now another big announcement. The Erie County Medical Center, utilizing DSRIP funding, which is specialized funding that it had received through the Millennium Collaborative to address disparities in health, especially with those of Medicaid patients, is providing $2.3 million to provide support 27 sites in 15 priority zip codes across Western New York to perform testing of individuals. These sites include private practices, ECMC, Kaleida Health, and they're located in Amherst, Buffalo, Dunkirk in Chautauqua County, Jamestown in Chautauqua County, Lockport in Niagara County, Niagara Falls, North Tonawanda, and Wheatfield in Niagara County, as well as Williamsville. And there are many locations. To give you an idea, here are the participating practices that are participating, so to speak, in this assistance from Erie County Medical Center with these sites across Erie, Niagara, and Chautauqua County. They include the Rafa Family Wellness Center, Community Health Center of Buffalo, of course, ECMC's Family Health Center, Evergreen Health, Jericho Road, we talked about Jericho Road, Kaleida Health, of course, but also the Neighborhood Health Practice and the Urban Family Practice are participating. Urban Family Practice, I believe, is part of the G-Bond network. You are to call a specific practice group to schedule an appointment. So if you want to get tested at one of these locations, you need to call a specific practice group. So if you wanted to go to if you're a patient of Rafa Family Wellness Center, or you are an individual who goes to the Community Health Center of Buffalo and you want to get tested, you need to contact them for testing. They are going to be able to test based on the $2.3 million? Yes, $2.3 million of funding that ECMC is providing to these various organizations for increased testing. Now, commissioners' isolation orders. If you have symptoms and are getting tested, you have to isolate yourself. If you have symptoms of COVID-19, there's a good chance you may have COVID-19. It's not guaranteed, but there's a chance you may have it. You need to isolate yourself. If you do not have symptoms but are getting tested, you do not need to isolate yourself, but you do need to monitor your conditions. And if you do show symptoms of COVID-19, a fever greater than 100.3 temperature, the dry cough, the shortness of breath, the issues associated with chills or sweats at night. Some people are having gastrointestinal issues. If you have these symptoms in between when you get tested and you're waiting for results, you need to call your doctor and tell your doctor about this. And if you don't have a doctor, you can call the location where you got tested to help assist you with what needs to be done next. If you do not have symptoms, you're free to go about. You do not need to isolate yourself, but if you do have symptoms, under the Commissioner of Health's orders, you have to isolate yourself until you get your results. Hopefully they'll be negative. If they're not, well, then you need to once again take the next step, and our Department of Health will be contacting you to tell you what that is. The reopening status with New York Forward, we already talked about this. We have met 5 of the 7 criteria. We were headed in the right direction with regards to the first criteria regarding hospitalizations. We actually have seen a decline in overall hospitalizations in the 14-day period from where we were 2 weeks ago to where we are today. What the problem is that line was going down and now it's going back up. New York State looked at that and said, we're not ready to reopen. And I understand why. We were trending in the right direction. We had really good data for a number of days, and then all of a sudden we're starting to go back up, and that concerns me and it concerns other people too. Trust me, folks, I want to reopen. I want to get us reopened as quickly as possible. I want to get our businesses back working, but we also have to do what's best to protect our community. We're all in this together, from the youngest infant to the oldest adult, and we are going to do what is appropriate to protect people in this community. The deaths, unfortunately, we're still seeing deaths in hospitals. While they are not as bad as they once were, we're still worried about them, and that we still have not met, though we've met every one of the other metrics. New York Forward, if you want to more information on the governor's plan to reopen the various regions in New York State, go to forward.ny.gov. You'll also find the regional monitoring dashboard there, the information I just showed you on the previous screen. And industries will be reopening by phase, so if you work in a particular industry, you can then see what is necessary when you can open and what you need to do to ensure that you can reopen. Because when we announce reopenings, it just doesn't mean businesses can reopen as they want. They have to follow the standards set by New York State, and those standards are available on the New York Forward website at forward.ny.gov. With that, we're going to open it up to some questions. I'm going to take a quick drink of water here. We will start from the top of my sheet. So the top of my sheet has WKBW on it. I believe Ashley Rowe is on. Ashley, what is your question?
Hi, Mark. There seems to be some confusion about how many contact tracers Erie County currently has versus is expected to have. You showed that graph just a moment ago. Does Erie County currently have enough tracers? And if not, can you explain what that expected term means?
Erie County has enough tracers for what we're doing right now. We have about 30 individuals working on contact tracing now. We've identified over 150 others that can and are truthfully taking the online class that's available. New York State requires 277, but New York State's also going to be hiring some contact tracers for regions. So they've marked us in the checkbox because we have enough contact tracers to address what we're dealing with right now. We're ramping up to address the future, and so are they.
Thank you.
You're welcome. WIVB TV, Christy Kern.
Hi, Mark. We're getting information that a person who worked inside a nursing home has died from COVID-19. What information do you have about that, and how is the county helping to protect workers inside nursing homes and hospitals?
I can't speak on any issue with regards to a person who worked in a nursing home and died. It may have happened, I don't know. We've been providing PPEs to nursing homes and hospitals. Earlier today, we started releasing up to 500,000 masks for general public use. I was there at our distribution location where representatives from the towns were coming in. This is for general distribution, but all along we've been distributing them to hospitals and nursing homes. And while I was there, a representative of nursing homes came and picked up their most recent allotment of specialized masks. We're giving procedural masks to the general public. They were getting some more specialized masks and some other equipment that they requested. So we've been providing that to the nursing homes. The New York State Department of Health is the primary provider of regulation associated with nursing homes, but we've been working as requested by the New York State Department of Health to assist them in any manner. I've been on the phone with directors of nursing homes with regards to issues at nursing homes, and we've been providing them PPE to help protect their employees. Anybody
Thank
on?
you.
You're welcome. Anybody on from Channel 2, WGRZ?
Yes, Mark, can you hear me, Mark?
I can, David.
Oh, thank you very much for taking my question. I want to ask you about testing. You got a nice green check mark, but the number's real close on that state dashboard. So I want to know if you got any clarification since we last talked. Is it a matter of the number of tests performed or the capability to perform a certain number of tests? If it's the former, could you lose that benchmark if you're not actually testing people?
It is the number of tests performed. With the new sites that I announced that are available through the ECMC funding, this will also ramp up testing. And as you know, the governor announced that they're going to be doing additional testing of nursing home employees. That will count towards the number, and I don't have any question that we're going to be meeting that number of the 30 per 1,000, I believe it was. We're meeting it now, and now that they're ramping up testing through New York State through the nursing homes, I have no question that we'll meet that continually. Spectrum News, Aaron?
Hi, Mark. So
Hi.
I understand the numbers are going up to the hospitalization rate in the last day or so, but do you have an opinion on if we have enough ICU beds to handle the uptick? Do you think that the metrics we're being measured on are fair?
I didn't set the metrics. We have to meet the metrics. We've had conversations with New York State. I had a conversation with the Lieutenant Governor last night. I had a conversation with high-ranking officials across New York State, as well as other elected officials. County executives had a call last night in which we were talking about the metrics, and we just realized that we don't set them. New York State did. Other areas have met them, and we're going to have to meet them if we're going to reopen here. It's as simple as that. Buffalo News, Sandra Tan. Sandy?
We've been looking at, yes, can you hear me?
Yes.
We've been looking at the data that the state has been releasing over the last 2 days and comparing it against the data that the county has been releasing. The daily hospitalization data and death data that you guys have released just doesn't match up to any of the data that the state has released for the past month or so, and I'm wondering if you can account for that discrepancy.
We're releasing data that's New York State's data. This is not our data. The data that has been released is New York State's. I mean, their dashboard is for Western New York, so it's going to include Erie County and other counties. But their data.
Yeah, we did request a data breakout just for Erie County, and for some reason, I mean, the numbers just are all a little bit off. I didn't know if maybe that had something to do with maybe they were being provided to Erie County at a different time and they're being reported on their website. I just don't know.
Possibly. I mean, you'd have to ask New York State that question. And I don't know if New York State is segregating out afterwards patients that did not live in Erie County but were in Erie County hospitals. When we get the data, it's raw. We'll get the data, for example, the data for the 11th we ended up getting late last night So we got it on the 12th. I don't know if they go back afterwards and they clean it up and they take out individuals who are not county residents. We get the raw hospitalization data, simple as that. And it's coming from the New York State Department of Health. It's not, this is the data from the health department. It's not coming from the individualized hospitals. I requested it from the individualized hospitals so we could see where we were as a trend, but we didn't include it in the chart on Monday because it wasn't what I felt was 100% accurate, because we wanted the data that New York State was relying on. We have it now, and that's what I released today. Michael?
I see. Well, that would actually make sense.
Okay. Michael Mroziak, WBFO? Michael, are you there? Are you muted?
Can you hear me better?
I can hear you. You're a little metallic-y. Go ahead.
It still has problems, I see. At this point, I know earlier today in a conference call, your counterpart down in Chautauqua County said that if it were up to them alone, they've met 7 of 7. Is Erie County really the last holdout among the 5 within the Western New York economic zone to make it to that 7?
I don't know. I don't know because I don't know what we're seeing from Niagara and Cattaraugus. I know P.J. Wendell, the county executive there, is very excited to want to reopen, but he's part of the region. And we have seen individuals in our hospitals in Erie County that live in Chautauqua and Cattaraugus County. So I can't say. I mean, Bertrand Chaffee Hospital in Springville gets a lot of patients from Cattaraugus County. So while we have hospitalization numbers that are higher here, it doesn't necessarily mean that every patient is an Erie County resident. Millard Fillmore Suburban often gets patients from just across the line. You have Amherst there, and just across the line in Lockport. So it's not unheard of for someone in Lockport or Pembroke, Pendleton to actually probably Pembroke too, to go to Millard Fillmore Suburban. We question with New York State, is it fair that we have hospitals like ECMC and Millard Fillmore Suburban that get patients from outside the Western New York region that live in Genesee and Wyoming County? And they said, yes, we understand that's the case, but this is how it's being done. So I understand what the other county executive feels. I understand what the other leaders in Western New York feel. But I can say that for the patients in Erie County hospitals, they're not all from Erie County. They're also from folks from other counties too. They may be lower because they just have a less dense population, but just because they're lower doesn't mean that we as a region are going to split off. We've been told by New York State it's going to happen by region, not by county basis. Anybody from WBEN?
Mark. Regarding reopening, I know that in past news updates that you've given to us, nursing homes account for so many of the deaths here in Erie County. Do you think there should be some sort of push county-wide or region-wide to possibly exclude nursing home deaths from the state criteria in order to reopen and treat the nursing home deaths as a separate number?
Well, I have talked to New York State about that. Every death is one death too many, and we want to do all that we can to protect all of our residents. They are aware that nursing home deaths make up more than 50% of the deaths, at least as of last week. We do know that when it comes to hospitalizations, people who are not in a nursing home make up a majority of individuals hospitalized, so it kind of goes both ways. They are monitoring that. I have explained to them my concern about that, but as it is right now, it is just total deaths. And when we talk about deaths, we're talking about individuals who have deceased in a hospital. So they're not counting against us individuals who have deceased in nursing homes. They have counted against us individuals who deceased in hospitals. They may have come from a nursing home. So nursing home deaths themselves are not the driving factor. It's the number of individuals dying that were in a hospital at any one point. Ethan Powers, B News.
Hey, Marco Baldwell. Just to get some clarification on the hospital numbers, as you said today and as the updated data from the state shows, we've seen a bit of an uptick in hospitalizations, but ICU numbers seem to be declining steadily. Is there an elaboration for why that is? I mean, is it possible that some hospitals are altering how patients are admitted to those units?
The answer is yes. You see the numbers, that this is the most recent 2-week period, minus the 1 day that we still do not have data for. And while the number has ticked upwards with regards to total hospitalizations in Erie County of 203, we do see a continual decline where they're actually at the lowest number they've been of ICU patients in the 2-week period, and basically since early April. And the same thing with ICU intubations. That is now at the lowest number it has been since early April. And they are using different formulas. They're not just putting somebody on an intubation and putting them on a ventilator. They're using some of the drugs. I think we've seen stories about what's happening in some of the, not experimental drugs, but what per se, because the drugs are FDA approved, but drugs that are being used from other purposes, like drugs that potentially might be used for a lupus illness is being used for this. Drugs that were used for Ebola are being used for this. So they're using drugs, therapy, more often now than just putting someone straight on a ventilator, which has a tremendously negative effect on their body even if they survive. We do know that individuals who have survived have not totally recovered. They're still dealing with health effects associated with the illness, including the seriousness of having been put on a ventilator. So we do know that hospitals in our region are utilizing different methods than they were originally, and as a result, we think it's one of the reasons why the ICU numbers have kept on going down, even though most recently we're seeing the numbers going up. To give you just a better understanding, it wasn't that long ago that roughly half the individuals that were in hospital were in an ICU, and now we know it's substantially below that with 203 individuals in hospital, but it's only 72 in the ICU. So that has dropped appreciably, and I think it just goes to show the great work that the teams in our area hospitals are doing to safely and to do as best as they can to save lives, but to limit the amount of harm that may be caused by an individual due to intubation that certainly has a negative impact on an individual. Going back up to the top, WKBW, or first off, is there anybody else I have not asked? If not, WKBW, Ashley Rowe.
Hi again, Mark. Yeah, we're getting calls daily about the reopening of the DMV. Are you having any conversations with the state about when that could happen? Do you have any idea of when it could reopen?
I don't have any idea. It is something that they're contemplating. It's just like they do not and have not figured out what phase barbershops and beauty parlors are in, or places of worship. Those are still to be determined. Our DMV is available for some services through a curbside work that Clerk Kearns and his staff are doing. And I would suggest you go to the erie.gov website, click on the clerk's page, and you'll find out more about that. So there are some services like license renewals as well as registration renewals. You can purchase a new vehicle. This is a question we've had too. Auto dealerships are available to purchase vehicles, but you have to do it on an appointment basis. You cannot just walk in. So if there's a vehicle that you're interested in, you should call the dealer and see if they're open for sale. And if so, they can do an appointment. I don't believe they're doing test drives of vehicles, but if there's a vehicle you're interested in, you can purchase it, and the clerk's office will help you with the registration. So there is work that's being done. It's just not to the normal capacity that we see before this COVID-19 outbreak.
All right, thank you.
You're welcome. Christy Kern, once again, Channel 4.
Hi, thank you. The latest guidance doesn't give a phase for salons and barbershops to reopen. Is there any update for owners for that? And also, in terms of reopening, when will parks operated by the county be open for camping?
Parks for the county are closed for campgrounds through May 30th because they require, well, not all, but we've decided to close all camping in Erie County parks for May 30th. Camping, as you may know, for vehicles that have self-contained restroom facilities are available on private campgrounds. That is now open. We said we were working with New York State, and they did. New York State, and we are not ready to open the other types that require their own bathroom facilities or shower facilities. So while Erie County campgrounds do have the ability at Sprague Brook Park to have RV hookup, We have decided to not allow that until at least May 30th, and we'll announce at that point whether we're going to open the campgrounds at that point for at least RV usage, if not, at this point, tent camping. Next question, I think goes to Channel 2. David, are you still there?
Yes, I am still here, Mr. Executive. Thank you. I'm going to preface this by saying that I know you're not a doctor, but you do have a health director who you huddle with regularly. I'm sure you're in touch with the medical community. So when we look at those two criteria, those two benchmarks where we're kind of going the wrong way or not beating them, the decline in hospitalizations or under new 15 hospitalizations a day, or the 14-day decline in deaths or fewer than 5 per day. Based on what you've been getting from medical people, do you have a thought on what is the more realistic of those criteria that we might meet, or which one might be harder to meet?
Well, based on the data and the conversations I've had, I felt up until yesterday night that we were trending in the right direction to meet the first criteria with regards to hospitalization declines. We have seen a decline in hospitalizations over a 14-day period. That has occurred. If you go back 2 weeks, we have less cases. I think we have about 50 less cases. The problem is the last 3 days we've seen increases. So I think that's the one that's the easiest to meet. Deaths is, once again, that's depending on the seriousness of an illness. But we have at least trended better recently with regards to the deaths coming from hospitals. In Erie County, I don't know what's happening as it pertains to individualized data from the other counties. As I noted, there are not many, but there are people in hospital with COVID-19 in Niagara, Chautauqua, Cattaraugus, and Allegheny counties. So those numbers also are part of the Western New York number. I think if we can reduce the hospitalization number, I think the deaths will go along with it, because the less people that are being hospitalized, the less chance there is of actually having someone die in a hospital. Aaron, Spectrum News.
Of reopening, what does phase 1 mean for social distancing? Should people still be staying at home as much as possible? Are you able to gather in small groups at that time?
You should continue to follow social distancing, smart social distancing practicing. You should be wearing your mask anytime you're out in public. There are going to be limitations even on the businesses that open. They're not going to go up to 100% capacity. They're going to have a limited capacity. So just for a business that opens that normally would have, let's say, 125 people, they may be required to be at 50% capacity depending on the size of their facility and what they do. So we do know that some businesses, when we get to phase 1, will reopen in the construction, the manufacturing, and retail areas. But that does not mean that we should just go about our business and we can start having parties again in houses. There's still going to be restrictions. I still believe they're trying to keep groups to less than 10, is what I've been told, even in phase 1. So it's not really that much different. It's just we allow some businesses to reopen, but for the vast majority of us, we still need to follow the same protocols as before. Sandy, do you have any other questions?
Yes. Erie County was the first to put up a very detailed and useful tracker, COVID-19 tracker. That information is information that's been so helpful that it's been embedded online, as well as we run it in print every day. We have noticed, however, that since the start of this month, that tracker has only been updated Monday, Wednesday, and Friday mornings, the same days that you were holding your press briefings. So I'm wondering if that's the way it's going to be from now on, or do you intend to have the county's COVID-19 tracker updated daily again at any point?
I'm just going to put it on the screen here so it can get pulled up. But it actually has more to do, not with me, it has to do with the staff, because we've broken staff down where they're not working every day anymore. And staff are working 5 days a week, and also on the weekends. So the staff that maintains that, there are a couple days a week in which we are very limited on that staff. And so those individuals are not there that day. But we are getting information. I want it there as much as possible. Just to show you, we did make a change We added, of course, the PCR swab test. You can see the total. And then if I click here, you'll see it'll flip and you'll see this percentage of swabs. And then we also put the antibody tests on there that have been completed, 21,139, and the percentage of overall that have tested positive at this moment. Of course, on the side here, you have the numbers per day, so you can look back and see what the number is, and then you just subtract the day before and you figure out what the growth is. So if you look at 5/11 and you go back 5/10, you'll see there's a difference. You subtract the number, and that'll tell you how many individuals tested positive on that day. And of course, we still have it broken down by town, city, and then of course we have it by zip code. So zip codes do not translate necessarily with town lines. There are zip codes that cross town lines, so it's not a true example of what's happening in any one town, but it does give you a good idea of what's happening in particular locations. So that data, we're trying to update it as much as possible, but now that individuals are basically not working 7 days a week, many hours a week, but we're working 5 days, we're splitting them up over the 7-day period, and so some of the stuff is not being updated as quickly as even I'd like, just because of staff issues. We'd have to, at this point, think about hiring more people to do that, and as I've talked about, we're facing a budget crunch, so I'd rather wait 12 additional hours for the information than have to hire someone only to potentially let them go. Mike Mosier?
Right, but that map isn't even.
What?
I was just saying that map isn't. I was simply saying that the map wasn't even being updated, except for Monday, Wednesday, and Friday mornings. So
That's
I mean,
not
if it
correct.
Could, I realize certainly that.
That is not correct, because I know it was updated over the weekend. I know the only day I know that it wasn't updated, it was updated last night with regards to confirmed cases. We updated the deaths this morning. If we get information on more deaths through the afternoon, we'll update that. But sometimes we don't get them in the evening, we'll get them in the morning. We usually are updating it at least twice daily, but there was one day that I know of where it was not updated, and it had more to do with the individual who provides that data just wasn't here.
Okay, we just don't have any information for the 8th or the 9th, or the 6th or the 4th or the 2nd.
Are you talking about hospitalization?
No, the breakdown for each community on the COVID-19 tracker.
I believe it was updated. I don't know. It may not have been updated. The maps were updated. I don't know if they put up the updated information every day for every town, but I know it was updated for deaths. And it also depends on when the staff gets the information with regards to cases from New York State. So if you look at it, those dates that you talked about are also some of the dates we had problems with the hospitalization data with New York State. So we may have been updating the maps, but it may have also coincided that some of that data, because the information on the tests comes from New York State. We don't get it directly from the testing sources. They go to the New York State Department of Health. It goes into its system, and then we get the data after it's been input in the system and released to the county. So it's quite possible those days are also days that we had issues, just like we did with the hospitalization with New York State. Mike Mrosiak, any more questions?
I think I'm good. Thank you.
You're welcome. Mike Baggerman, any more?
Yeah. Regarding phase one of the reopening plan, one of the things that's in that is that retail companies can do curbside delivery, or rather curbside pickup. I guess, what's your understanding of it? Because aren't a lot of retail companies still doing curbside pickup? I know fabric companies are doing it. Places like Dick's Sporting Goods does curbside delivery. I mean, what's really new with the retail aspect?
Well, the delivery they could always do if they had the capability of delivering. The curbside is different. Unless they were deemed essential, they should not have been doing it in the first place. So if it's a company that has been doing deliveries, yeah, they could have done that as long as it didn't put at risk their employees. But they also could have been deemed essential by New York State Empire State Development, and as such, they would have had the ability to do additional work before they enter into phase one. There's a lot of things that are listed in phase one, retail opening, that we know have not been opening, just like jewelry stores, shoe stores, clothing stores. Most clothing stores have not been open. They've all been closed. So now they have the opportunity if they so choose. Many may not reopen if they feel it's not worth it because they don't have the foot traffic. They may not reopen, but others probably will. But right now, we're talking about a hypothetical because we haven't reached phase 1 yet. We're not going to make it this week. I'm hopeful we make it soon, but if that statistical analysis that we showed you with regards to the number of hospitalizations continues to go up, we're not going to reopen. It's as simple as that. We got to go downwards, folks. We got to get that trend line headed in the opposite direction. Final question will go to Ethan Powers from BE Newspaper.
Hey, Mark. Yeah, speaking in regard to getting that trend line down, you know, obviously we're now trending slightly in the wrong direction, as you said, when it comes to those hospital numbers, which are the two reopening metrics we're not meeting. From your perspective, Mark, you know, has county government kind of exhausted its ability to expedite a potential reopening at this point? Are those, you know, the hospitalization numbers that we need to meet, are they solely dependent upon a lack of community spread and therefore up to residents at this point?
Yes, and yes. I should say yes, yes, and yes. The county government has exhausted what we can do. It is up to keeping the community spread down, and it's up to the residents. I said this on Monday. It's really in our hands. And when I say our hands, I mean all of us in Western New York. I can only do so much. We've met the standard that we need for contact tracers. We've ramped up testing. We've met the parameters that we can meet. The hospitals have met the parameters they can meet by having sufficient ICU beds and total beds available. It's now up to the public. And if the public doesn't want to follow the rules and thinks this is all a big joke and some of them are getting sick and going to hospital, well, they're hurting the rest of us. As I've said before, we are all in this together. We have to be our brothers and sisters' keeper. If we do that, we have an opportunity to open. If we don't, we could be stuck in this phase of not opening for some time. I want us to open just as much as anyone else. It's just incumbent upon the public to act appropriately, and we need you to do that so that we're all in this together and those hospitalization numbers go down. With that, I thank media once again, and I thank each and every one of you for participating. We went an hour earlier than usual. I'm actually participating in a call at 3 o'clock with a number of my colleagues from across the nation, talking to representatives of Congress and their staff about the need for assistance on the local level. You may have seen the House release its HEROES Act yesterday, a plan to assist local governments, state governments, and others get through the coronavirus and COVID-19 outbreak. I wholeheartedly support that plan. I thank Nita Lowey, the prime sponsor, a congresswoman from New York State, as well as Speaker Pelosi for introducing it. I know Brian Higgins supports it. I thank him for his good work, and I thank Senator Charles Schumer for his good work in helping put that piece of legislation forward, a piece of legislation that he supports. If you live in our region, you should support this legislation because it's going to give us the tools that we need to avoid mass cuts, and it's also going to help families that are in dire need and others that need assistance because of the loss of job or revenue from other sources. So with that, until I talk to you again, I hope everyone is safe, continue to be well, and continue to support smart social distancing practices. And if you do that, we'll get through this sooner. And along the way, every now and then, I'll play you a song. I was up late last night. I played another one, another song for friend. You can find it on my YouTube page. I hope you like it. It's one of my Beatles favorites. And as we all know, that we are all in this together in our lives, and compared to what I played last night in my life. Take care, everyone. Be safe and be well.